Hi there. My name is Dr. Arya Nielsen. I want to thank Dr. Heather Tick for arranging these talks and IASP for inviting me to speak on another aspect of acupuncture therapy, Gua Sha, as part of comprehensive pain care. So, what is Gua Sha? It is a healing technique of traditional East Asian medicine. It's defined as instrument-assisted unidirectional press stroking of a lubricated area of the body surface to intentionally create transitory therapeutic petechia called Sa, representing extravasation out of the vessels of blood cells in the subcutis. And those fade over 3 to 4 days. You can find out more information at the website. Just to say here, Gua Sha is not Gua Spa. What many people are doing in spas for beauty, they're calling Gua Sha, is not Gua Sha because they're not raising any petechia, which is Gua Sha by definition. Gua Sha itself is practiced throughout Asia in Asian immigrant communities and by practitioners of traditional East Asian medicine worldwide. And it's useful to any licensed therapeutic practice, acupuncturists, massage therapists, PTs, physicians, nurses who work directly with patients. But again, it's not the same as Gua Spa. Science says Gua Sha produces an anti-inflammatory and immune protective effect, and I'll show you why in a second, that persists over days following a single Gua Sha treatment. That research done at Harvard accounts for its effect on pain, stiffness, fever, chill, cough, wheeze, nausea, vomiting, and so on. Gua Sha is also effective in acute and chronic internal organ disorders, including liver inflammation and hepatitis. There is a cultural bias and ignorance that has come with Gua Sha, where medical providers have mistaken Gua Sha, petechia, and ecchymosis, and with cupping, petechia and ecchymosis too, as abuse, pseudo-abuse, burns, dermatitis, dermabrasion, torture, which it is not, but has resulted in the persecution of East Asian immigrant families. This rendered quite nicely in the most popular film in China in 2001 called The Gua Sha Treatment, which you can access on YouTube. I did a talk for Healthy Seminars on the science of Gua Sha. That's what the petechia actually look like. But you can, for more detailed analysis of the science of Gua Sha, you can access that on Healthy Seminars. There are CTs of Gua Sha for neck pain, back pain, including in older patients, breast engorgement, mastitis, menopause, perimenopause, and it's mainly to reduce hot flashes, heat stroke. It increases the immune response to vaccinations, has an antiviral effect, peripheral treatment for peripheral neuropathy, and increases athletic performance. But I'm not going to detail those citations here. Just by way of saying, in general, heme oxygenase 1 has become a therapeutic target by pharmaceutical companies, and a therapeutic target for pain, lung inflammation and injury, cardiovascular disease, hepatic disease, renal inflammation and damage, ischemia, reperfusion, brain degeneration, and Alzheimer's. And Gua Sha has been shown to be a natural inducer of HO1, which has long been known to provide cytoprotection, cell protection against oxidative stress. The upregulation of HO1 is thought to represent antioxidative response to circulating hemoglobin products that are released by Gua Sha and then reabsorbed. So if this were a drug, it would be considered a medical breakthrough. And to that end, I would encourage you to explore more the use of Gua Sha in your or in referring to others in clinical practice. And again, this is for those of you who are interested in my background. I provide you that slide here at the end. Again, thank you to Heather Tick for inviting this talk and IASP for sponsoring.